Interesting stuff to talk about. Now, of course, naturopathic medicine in the United States has been not that well received politically. And naturopathic doctors, for instance, my profession right now is only licensed and regulated in 18 states in the United States, even though naturopathic physicians have graduated from fully accredited medical schools, right? It just doesn't make sense. There has, in fact, been a lot of political opposition against naturopathic medicine and, quite frankly, other types of holistic medicine here in the United States. The chiropractors had a huge uphill battle. How has it been politically in the United States for traditional Chinese medical doctors and acupuncturists?
So right now in United States, I think I do some research. I think over 50 acupuncture schools, in the United States. For example, in Chicago has 2 schools. I don't know.
So in Illinois, right, is traditional Chinese medicine and acupuncture licensed and regulated? And do you have, are there certain things that you're allowed to do and not to do? And what's that like in the rest of the United States?
For most states has a licensed acupuncture. Licenses, you have to buy licensed acupuncture. So you have to graduate after graduate school, acupuncture school, then get a board test, then get a license.
And currently, traditional Chinese medicine and acupuncture is licensed and regulated in all 50 states?
Yes, most. Maybe just, I think maybe only 2 states right now don't need acupuncture license, but all the other states all has licensed acupuncture.
What about insurance coverage? If people come to see you in Illinois, will insurance pay for your services or not?
This is a good question. Let me see. In East Coast, in West Coast, most insurers cover acupuncture because over West Coast, most people use acupuncture. So insurance company have to cover acupuncture. But in the Midwest, little bit slow, little bit closed because not open yet. And I think in Illinois, around 10% insurance company cover acupuncture. So, but in the West Coast or East Coast, 90% insurance cover acupuncture.
Yeah, it's interesting. I've always said, that if we woke up tomorrow and by some magic there was full insurance coverage for naturopathy, homeopathy, acupuncture, traditional Chinese medicine, if in the United States there were just as many hospitals of acupuncture and homeopathy and naturopathy as there are conventional medicine, if the acupuncturists and the naturopaths and the homeopaths and the herbalists got a fair share of the research dollars, and if there were research facilities dedicated to these things, if in fact we had a level playing field in the system of medicine, quite frankly, conventional medical doctors in the United States practicing Western medicine would all be out of a job within 5 years. Because for chronic illnesses, because for most of the things that most people visit the doctor for, Western medicine really just doesn't work, and it doesn't work. It's great for surgery when surgery is necessary. It's great for trauma care and a handful of infectious diseases. But really, most people and this isn't just a United States phenomenon. I think this wraps around the entire world, that we're very stilted here in the 21st century, and everything really. The pharmaceutical industry and conventional medical doctors really do own the lion's share of medicine. And I really appreciate people like you who have, you're the underdog, right? I mean, you're the underdog, especially here in the United States. And yet you go to work every day, you try to make a difference. And I think it speaks volumes towards, your personal integrity. Okay, so now traditional Chinese medicine has a couple of different aspects. We've talked about the energy meridians and the acupuncture needles. We've talked about the pulse diagnosis and the tongue diagnosis. Let's talk now about Chinese herbs. Tell me a little bit about the use of herbs in traditional Chinese medicine.
Yes. In generally, use Chinese herbs to treat the body. You have to first do diagnosis to look at your body energy level and which channel and your body condition. Because the Chinese men think body has a yin-yang aspect and the 5 elements like wood, fire, and earth, metal, and water. These 5 elements have to each control each other to make the balance. Because if which one too excess to abuse the other one, then body unbalanced. Yin yang also like daytime, nighttime, hot, cold. You have to unbalance. Yeah, you have to balance. If too heat, then abused. Then your body too dry, too heat, too damp. Then your body has an unbalanced problem. So we use acupuncture or we use herbal to treat this kind of problem. So herbal also has a different property. Like some herbal is warm herbal, some herbal is cold herbal. So use cold herbal to treat the heat problem. For example, cold, flu. People had flu. In Western medicine, treating the flu use all the same kind of medication. But in traditional Chinese medicine, different. So first you need to check your pulse and look at tongue to do diagnosis of what type of flu, like when cold or when heat. If when cold, we use a different kind of herbal. If when heat, when we use other different kind of herbal. Like a tea, some tea has a different property, like a warm tea and a cold tea. Like in the summertime, we suggest people drink green tea because green tea is cold to clean heat. In the summer, too hot, so use green tea to clean body heat. In wintertime, use black tea. So black tea is a warm tea to help give you heat in the body, to help circulation, to make your body more balanced. So this is very different. So for this kind of herbal, you have to go to herbalist or acupuncturist to check a pulse, then know and look at tongue, know your body condition first. Then if you prescribe to what kind of herbal, most herbal, some kind of formulas. So combine all the maybe 5, 10, 15, 20 herbals, formula herbal, then you can take a drink.
Interesting stuff. So again, this speaks to the holistic concept that when it comes to the disease process, you don't treat the disease, you treat the patient. And 5 different people, all who have the flu, they might have given it to each other. If they went to see a holistic practitioner, would ostensibly get 5 different treatments because they have 5 different bodies and they're all imbalanced in different ways. And it's the sophisticated physician's job to figure out where each individual is weak, where each individual is strong, and to adjust the therapeutic appropriately. This really does kind of put Western medicine to shame, right? Because with Western medicine, everybody gets the same thing. It's one size fits all, and it's a little bit silly. I never knew that about, so green tea in the summer and black tea in the winter. Isn't that fascinating? Okay, so I see in your curriculum vitae that you hold the patents on Chinese herbs. Is that correct?
Yes, this is for injury. This herbs paste. Herbs paste. If injury strain the joint and the muscle tendon, use herbal paste put on the skin to quickly to reduce pain and reduce swollen and reduce blues. I have a lot of patients after injury put my paste, herbal paste, quickly, maybe around 1 week. This is swollen all down. So reduce pain, yes.
Now, in the United States, when we talk about herbs, what most people are used to are herbal teas, of course, herbal tinctures, alcohol tinctures in, 3, 4, 5, or 6 ounce bottles. Or sometimes we get powdered herbs from Germany in capsules. When you're delivering a traditional Chinese medical herbal formula, what form are the herbs in? And generally speaking, how does the patient need to take them?
Yes, in United States, most herbal formula is pills. Second one is capsules, and herbal tea pack. So this is three kinds most. But some people like use traditional old-fashioned type herbal cook, like herbal need to cook formula, herbal formula put it in the pan to boil around 20 minutes, boil in the bowl. There's a boil herbal 20 minutes, then drink this herbal water. This is traditional way. In China, most people use this old fraction way, because this is all the formula, because everybody doctor check pulse, give you different patient different herbal formula. So then you cook by yourself, drink. But if pills, this is regular pills, so everybody can use the same formula. So this is actually not good for individual patient. So why some patient like see doctor to only use this patient only use his formula, different from other patients. So this use cook herb.
So generally speaking, if you were to recommend a Chinese herbal formula for somebody, would you write down on a prescription pad or on a notepad the things that they needed to go to the pharmacy and buy, the different herbs that they would have to buy, and then take them home and put them together and cook them up, like a recipe for a soup? Is that kind of what you're talking about?
Yes, exactly. Yes.
All right.
Yes.
Now this begs the question, right? Of course, this begs the question, because I've seen some of the things that go into these herbal concoctions. What do they taste like, or is that an impossible question to answer?
Oh yes, if cook herbal, that's herbal water. For some disease, for some problem, this herbal water is little bit bitter. But for some formula, drink taste is good. So different, depends use what kind of treatment and use what kind of herbal. So some herbal very bitter, some herbal is sweet. Yeah, so different.
Fascinating stuff. Now, are in your practice, Dr. Chen, what percentage of patients get herbal treatment as well as acupuncture? Does everybody get an herbal treatment, or how is that determined, generally speaking?
Yes, if a patient coming for pain, then most patient don't need herbal. But if for internal problem, yes, everybody need herbal medicine, herbal medicine for internal problem.
And generally speaking, again, it's a kind of a vague question to answer, and I know that there's individuality here, which is very important. But generally speaking, when you put somebody on an herbal formula, how long do they need to be on that herbal formula in order to experience results? Is it a week? Is it a month? Is it 6 months? Is it a year? Generally speaking, how does that go?
Okay. In generally, around 2 weeks start working. But for some problem need to take longer, maybe around 2 months to 3 months. To continue, start 2 weeks start working, but need to continue working on their fitness treatment around 2 or 3 months.
And can people take traditional Chinese medicine, herbal medicine, while they're taking Western prescription medications, or is there a conflict?
In generally, for some herbal, yes, no problem with prescription. That's okay. But for some problems, some herbal you cannot take it together. But so my opinion, my preferred herbal, when you take herbal medication, don't together with prescription.
Okay, very good. So we're almost at the end here, and remember we can edit this, and we're going to edit it. How much time do you have left here with me?
Around 20 minutes.
Okay, I'd like to redo some of the stuff that we did at the beginning, because
Okay.
the signal was choppy and it just wasn't coming through okay, and I really would like to, so if that's okay, I'd like to kind of go back to the beginning and ask some of the questions that I asked up front. You okay with that?
Okay, yes.
Okay, very good. All right. Here we go. By the way, you're doing a great job. You're a natural at this. You should do this more. You should have things like this for your patients. You're very, very good at it. You're very easy to talk to and very informative. I'm having a lot of fun here.
Model for all the meridians.
Yeah, can you hold that a little closer to the camera?
Yeah.
Yeah, it's hard to see because it's white.
Yes.
Yeah. Okay, good. All right. We can throw up graphics on the screen with, pictures like that with the energy meridian.
Yeah, you can, yes.
So we're good. Okay. So I'm going to jump back to the beginning. We're going to redo some of the stuff we did up front, and I appreciate your patience very much. Okay, here we go. So today we're talking to Dr. Leon Chen, an expert in traditional Chinese medicine and acupuncture. So much to understand about traditional Chinese medicine and acupuncture. Holistic medicine, of course, is difficult for most people in the United States and in Canada and in the European Union to understand because it's not mainstream, and yet it's still Western rooted. Traditional Chinese medicine and acupuncture, of course, is an Oriental tradition, and it's a holistic tradition. So often it's a bit of a challenge for people in the Western world to really grok, understand, and appreciate traditional Chinese medicine and acupuncture. This is why I'm very excited about today's interview. Dr. Leon Chen, as you've heard from his bio, one of the world's leading experts in the practice of traditional Chinese medicine. Dr. Chen, welcome aboard. So very nice to see you. Thanks for coming. So I guess the first question that is on everybody's mind, right, is what is acupuncture? If you can give us kind of the general foundation overview of the science of acupuncture.
Okay. Acupuncture acupuncture from China. So practice over 4,000 years old, over 4,000. So acupuncture just one method of traditional Chinese medicine. Traditional Chinese medicine include other methods as acupuncture, herbal medicine, and tuina manipulation. Tuina manipulation, like here, massage, but very different from massage. That's only for treatment problem like herniated disc. We use manipulation. So this kind of include acupressure, include massage, include adjustment. So that's all together called tuina manipulation. And also use cupping. So cupping use glass ball to cupping to help energy flow. And also gua sha. Gua sha also very different. A lot of people don't know gua sha, like skin scraping, gua sha to on the gua sha on the channels, gua sha channels. So this all together called traditional Chinese medicine. So acupuncture, we use acupuncture needle prick to or into acupuncture point to help energy flow or help stimulate energy to stimulate the point, acupuncture point, to make the energy flow in the body. So this is acupuncture do.
This is an interesting concept, right? The acupuncture concept is that there are invisible channels inside the body called meridians through which the vital force, the energy of the body flows. And it's the intention of the acupuncture treatment to free up the energy flow, to undo the energy blockage. And, it's kind of like in the human body, we have the circulatory system, the blood vessels, the arteries and veins, and the lymphatic system. And of course, we can see these and dissect them out of the human body. But the energy meridians are invisible, and yet they're present. And it's the intention of the acupuncturist to with the acupuncture needle therapy to adjust the way that the energy flows inside the body. Is this more or less, am I more or less in the right ballpark here?
Yes. Chinese medicine think body has 14 meridians, 361 points on the 14 meridians. Each meridian contact each organs, make a circle, energy flow on the meridians. If which meridians blocked, energy cannot flow, or which meridians energy low, then part of the body or part of the organs function being problem or disorder. So we use acupuncture to help stimulate acupuncture point to make the energy flow to balance body.
How were the meridians discovered or, figured out? Of course, you can't see them, you can't measure them. So does anybody have a sense of how they were determined in the first place? And, how do we know that there are 14 meridians, not 15 or 16? And how do we know that there are this many acupuncture points and not 100 more? How was that all figured out?
This hard question. This because the Chinese medicine is all coming from experience. So from 1,000 years before, so a patient feel some pain, always use a finger or use a stone, use some kind of metal to press on some point, then make the body pain better or make some digestion better. Then gradually, then people writing down, make a long time, like thousands of years, and then a lot of people writing down some experience, and then make all together, make a theory. So made reading book, said, which channel, which point made which problem better. So that's all the experience made together. People to writing down to make a theory to find out which channel help which organs or which channel contact which organs. So made this kind of experience coming up from thousands years.
I think this is an important point to ponder and to consider, because in conventional Western medicine, right, it's all about objectivity and the patient is left out of it. I mean, most of Western medical therapeutics were determined from corpses, from the examination of dead tissue, dead bodies. It's the experience of every single holistic discipline in the world that it's trial and error and observation. And we have a foundation philosophy that we build upon with clinical experience, and then we adjust and change and adapt and evolve and learn more. And this really speaks to the practice of medicine, which quite frankly, in my opinion, is wanting here in Western medicine. It's all very clinical, it's all very cut and dry, and for goodness sake, take the patient's experience out of it. All we're really concerned with is biochemistry and what we can measure. And I think it's more than just a little lopsided. Now, when someone comes to see an acupuncturist or traditional Chinese medical doctor who's using specifically acupuncture, how do you figure out where to put the needles and which meridians are blocked? How do you determine that?
Yes. So if you want to know this one, you have to when you go see doctor, a traditional Chinese medicine doctor first to check a pulse and look at tongue. Because Chinese medicine think body has a pulse has 27 different kind of pulses. So each kind of pulses show your body different condition. And
now, hold on. Did you just say 27 different types of pulses? That's quite remarkable. It's a little bit different from what I was taught in medical school. Can you speak a little bit more about that?
Oh, yes. The 27 pulses to look at in generally, most people know, how fast, right? Yeah, this is just one kind of pulses. And also need to see pulses deep and superficial, and pulses strong or weak. Like sometimes pulses too tight and sometimes too loose. Sometimes pulse like a wire. Some pulses like a rock. That's all the different.
This is a fascinating thing to think about, ladies and gentlemen. Traditional Chinese medical practitioners, traditional Chinese medical doctors are trained to be able to listen and feel and sense 27 different variations in the pulse found in the wrist, left or right, of the human body. This is where the practice of medicine evolves into the art of medicine, and the art of medicine is patently absent in conventional Western medical discipline. Can you imagine going to school and working your way through clinical practice, having to bend your mind around becoming adept at understanding 27 different variations on the pulse? Well, this is what traditional Chinese medical doctors are trained to do. And quite frankly, I believe this is what raises them above the crowd. Okay, Dr. Chen, so we're listening to the pulse, we're getting a sense of the pulse, we're feeling the pulse in 27 different variations of the pulse to be able to determine which parts of the body we need to look at for acupuncture treatment. What else do you use in addition to pulse diagnosis to determine where to place the needles?
Yes, and look, tongue. This tongue, the color, very important. Some colors red, some yellow, some dark. And look, coating of tongue, coating, or some people call fur on the top of tongue. If too dry or too damp, this also should different, show the body different. Because in the body has 5 factors, like wind, cold, heat, dry, and damp. These 5 factors need balance. If too dry, then body not good. If too heat, too damp, also not good. For example, arthritis, osteoarthritis, like dry and heat, don't like cold and damp, because the cold, damp made arthritis worse, and the heat, dry made arthritis better, feel better. So patient knowledge. So this way, in Illinois, if people has arthritis after retire, move to Florida or move to Arizona because there's warm and dry. That's why different.
Isn't that fascinating, right? So from the traditional Chinese medical philosophy, there are 5 factors which are at play in the human body, which the physician attempts to bring into a state of balance. And those 5 factors: wind, cold, heat, dry, and damp. And it's your intention through the pulse diagnosis and the tongue diagnosis to get a sense of which of these 5 factors are strong and which are weak, and then to develop a therapeutic, the intention of which is to bring everything into a state of balance. Am I more or less in the right ballpark here?
Yes.
Okay, excellent. Now, once you've determined, what's going on in the human body through the pulse diagnosis and the tongue diagnosis, when someone is a candidate for an acupuncture treatment, from the patient's point of view, what does that look like? How does it happen? Are they seated? Are they lying? Are they standing? How long does it take? And of course, what everybody wants to know, do the needles hurt?
Yeah, most people come in, lay down on the table for acupuncture. Some people, you can sitting there, but most lay down. So acupuncture, lay down and very comfortable, make it comfortable, and use acupuncture to put in the body around between 5 to 15 points. Some doctor maybe put more. I heard some doctor do maybe around 30 points, acupuncture points. But in my opinion, my experience, I use between 5 to 15 needles for patient.
And generally speaking, 5 to 15 needles inside of so generally speaking, 5 to 15 needles. And how long does the treatment last? 5 minutes, 10 minutes, 20 minutes, 30 minutes? What's that like?
I think between 30 to 40 minutes treatment.
And for a chronic condition, for instance, tendinitis or blood pressure or asthma, how long would a patient need to be treated with acupuncture, generally speaking, in order to realize a positive result?
Yes. For tendinitis, sure, maybe around 5 sessions, then finish. And for asthma problem, take a little bit longer, around 8 weeks. For high blood pressure, so you need to take longer, maybe 3 to 6 months. But patient come in my office, most first 2 weeks come in twice a week. Then after 2 weeks, come in 1 time a week. For 3 or 4 weeks, then come in once other week. For long-term treatment, after 3 months, people coming for maintenance, coming every 6 to 8 weeks for maintenance.
For maintenance, yeah, it's very important. We talk a lot about maintenance and prevention in naturopathic medicine. What's your experience of people's in the West, of their experience of the acupuncture treatment, right? You know, nobody knows really what acupuncture is, and all that we're taught is, oh, the doctor's going to put needles in the body and everybody's afraid of needles. So it's a silly question, I know, because I've had an acupuncture, many different acupuncture treatments. It's virtually painless. But can you speak a little bit towards what people experience when they actually have an acupuncture treatment? Because there's a lot of misunderstanding here amongst us uneducated Westerners.
Okay. Actually put the needle into skin to point, don't have a lot of pain, just a feeling little bit pinch. So some people don't feel anything. Some people feel little bit pinch in the point. Then that's it. And some use after use needle and we with electro acupuncture. So use electrical to put on the needle, so you can feel a needle little bit stimulate like a little bit shaking on the skin, then to stimulate the energy stronger to help some kind of problem. So we use a regular needle or electrical needle.
And when people are actually experiencing the treatment, they're lying on the table, you've done the diagnosis and you know where to put the needles, and they're lying on the table and the acupuncture needles are inserted. Generally speaking, what do people experience in the moment during the acupuncture treatment?
Yes. So during the treatment, most of the patients feel energy flow, feel very calm. So a lot of patients tell me about this, say that, why in your treatment room, I'm very calm and I'm found sleeping very quickly and sleeping very deep, only 30-40 minutes. But in home, never like this kind of deep sleep. I say yes, because acupuncture to help your energy flow, make your energy flow very smoothly. So then you feel very calm. So then you sleep deep. And some patients feel like a sensation, like some kind of energy flow, this kind of sensation. For example, if you put the needle on the arm, some people can feel needle go energy flow to brain, to head. Some people flow to leg. So can feel this kind of sensation, some people, yes.
Yeah, take it from somebody who's been there, ladies and gentlemen. If you've never experienced an acupuncture treatment, you really must. It's a fascinating system of medicine, very old system of medicine, and you know, it works. Acupuncture is effective for many different types of treatments, many different types of conditions across the board. If you've never experienced an acupuncture treatment, quite frankly, you just don't know what you're missing. All right, Doc, look, I think we're good. I think we'll be able to edit a bunch of really good content out of this. If there's other things that we need to tack on as we go downstream, I'll be in touch with you. Maybe we can do this again for 5 or 10 minutes. I don't want to take up a lot of your time. I know you're very busy, but I'd like to put together a really solid presentation. Are you okay with that?
Yes.
Okay, great. So how long have you lived in Lombard?
We have 3 locations. So our first location opened office in the Lombard. Been since 2004. 2004, the Lombard office is the first open, and the second office in Chicago, Marine Drive, 2007, and the Glenview office, like today, my office in Glenview, since 2009. So right now we have 3 locations.
That's Lombard, Illinois, Chicago, Illinois, and Glenview, Illinois. Check out Dr. Chen's website. Ladies and gentlemen, thanks for your time. I am your steadfast advocate for health, Dr. Peter Glidden. All right, we're good, Dr. Chen. It's been a pleasure. Next time I'm in Chicago, I'm going to come by and shake your hand.
Thank you. Thank you.
I'm going to come in for a treatment as well, and I'm going to look forward to it. Thanks very much. You're great. We'll be in touch, okay?
Thank you.
All right, thanks a lot.